Good evening, sir. Is your mic working?
Yeah, just check. Good evening to you. Is that okay?
Yes, sir. This is good. Thank you.
Super. Great. Thank you.
Hello, Ritik.
Hey, hello, Miss Sunita. Uh, your audio and video are working fine now. Yeah.
Thank you. Anshu. Ma'am, can you please switch on your camera and mic just for testing? Ma'am, Anshu ma'am, can you hear us? Dr. Anshu.
Good evening, everybody. My name is Mahima and I'll be the moderator for the day. Before we begin, I request you all to participate in a small poll that we take in the beginning of every webinar. It's going to start appearing on your screens right about now. We have 5 minutes time. I request everybody in the audience and the panelists to please take the poll. Thank you so much.
Good evening, everyone. A warm and a humble welcome to the 15th webinar of the webinar series under Youth and Adolescent. My name is Shivani Bhatia.
Good evening, everybody. My name is Mahima, and I and Shivani will be the moderators of the day.
A brief introduction about SHARP NGO. SHARP stands for School Health Annual Report Program. It's a pan-India non-governmental health organization working from over 21 years in the field of health and holistic development of children and students. Talking about non-communicable diseases, NCDs are the world leading cause of death and several illness in children. And modifiable risk factors such as unhealthy eating habits, disturbed sleeping patterns, and physical inactivity are some of the major causes of non-communicable diseases in India among students and children.
When the lockdown was announced, we at Sharp were faced with a very unprecedented kind of challenge, that of staring through these hard times while also caring for our physical and mental well-being. As a public health NGO, we believe that healthcare should reach every nook and corner of the country. And this webinar series comes out of one such dainty effort. Undoubtedly, adding on to what Shivani said, it has taken a highly communicable condition like COVID-19 to highlight the dangers that inherit in the non-communicable diseases like cancer, diabetes, hypertension, obesity, heart, and respiratory ailments, to name a few. Young people living with non-communicable diseases may be disappropriately affected. On World Diabetes Day 2020, I welcome you all to this discussion today.
School age and adolescent offer an additional window of opportunities to modify non-communicable risk factor. And being the massive contributor to COVID-19 pandemic, it is so important that we educate and spread awareness to our future generation about non-communicable diseases. And for the same objective of discussion, we have with us our esteemed panelist, Dr. Anshu Sharma, Dr. Shweta Khandelwal, Mr. Omar Sharif Mohammed, Ms. Neeta Arora. We welcome you all. Also like to inform you all that Ms. Monica, due to some urgency, will not be able to join us today. And few instructions before we start the webinar, we request the panelists, we'll let each panelist speak first for the 5 minutes and then take up the question. And I request the panelists to stick to the time limit. Also, I request the audience to drop their question in the Q&A box. We will take up accordingly. And you can also mention the name of the panelist. And I request the audience to not fill the chat box with unnecessary messages. We may tend to miss the important questions.
Without further ado, I'd like to invite the first panelist of the day, Dr. Anshu Sharma. Ma'am is the HOD at Non-Communicable Diseases and Biochemistry Division at NCDs. She's also served as the Joint Secretary of CHS and in the Maternal Child Health and RMNCHA program. As a physician, ma'am has helped more than 20,000 patients and is currently involved in the fellowship program at the Palliative Care Management from Kozhikode, Kerala. Honored to have you here, ma'am. Over to you.
So thank you very much for this invitation. And I hope after this webinar, we'll be little more knowledgeable about the youth. And I think SHARP is doing a great job by being involved with these students for the last 21 years. I didn't know that. So yeah, so that is a big thing. And I really appreciate you all for that. So I can imagine how much of the effort you must be putting in, because this is a mammoth task. First of all, I'll start by greeting all the panelists and, thanking you all to be here and to be able to speak a little of my experiences and to share with you all a little bit of what I know about NCDs. So, first of all, I would like to say that NCDs in India have really, reversed the trend of mortality and morbidity. See, till 20 years back, we used to not have many NCDs. Rather, we would, we were having all the deaths due to communicable diseases and the issues of maternal and child health. And over the years, it's creditable that India has managed through the various national programs to be, to take up the challenge of the RCH, the deaths due to the maternal and child health issues. However, the NCDs have really taken over. Now, I would just like to draw your attention to to the figures that we face right now. The WHO has certain global goals, and out of that, the goal SDG 3 said ensuring healthy lives and promoting well-being for all at all ages. And out of this, the SDG goal 3.4 basically focuses on the premature mortality due to the NCDs, and we were supposed to bring down this premature mortality due to the NCDs. Nearly 70% of the total deaths in India are due to NCDs. We were supposed to bring down this figure by 1/3 by 2030. Rather, India had said that we would bring down this figure by 2025. However, the corona pandemic has really, thrown us all in a backward gear. So instead of this, we are not even able to keep up pace with the global goal of 3.4, that is reducing the premature mortality by 1/3. However, the good thing is that, this pandemic has made us realize that these NCDs, they are the worst things that are happening to, and especially, they are all preventable. So we can focus on the prevention part. And in this, again, I would like to draw your attention to one particular study in which, in India, they have given a focus on the death rate among youth. Now, in this particular study, among the 0 to 14, I'll just come down to the exact figures in a moment. So between 0 to 14 years, all the deaths, the total deaths, they used to be, they would be, around 81% due to communicable diseases, 12% due to NCDs, and about 7.2% due to injuries. However, as we just go a little above, for the youth, that is between the 15 and 39 years, now this particular rate really shocks you. So out of 1 lakh individuals among 15 to 39 years, the communicable disease toll is 29%. The total deaths per 1 lakh due to NCDs has now shot up to 34.4%, which was earlier. In the previous age group, it was only 12%. And due to injuries, it is 36.5%. So you can imagine how much, the behaviors and the various preventable risk factors that we have during the youth, how much they are affecting the quality of life during your adulthood and the old age, and how much they are contributing to the premature mortality during adulthood. So basically, when we say that NCDs are preventable, we are talking about focusing on the risk behaviors and the attitude and the things that we can control during the youth phase, that is between the 15 and the 39 years. So these, as you very rightly mentioned earlier, the unhealthy diets, the various kinds of physical inactive behaviors, the trend towards binge watching and being on the net all the time, being on the phone all the time, and also one major thing is the habitual tobacco smoking and the attitude of the youth towards alcohol abuse. So these various factors can easily be prevented, and we can focus upon educating the students and the youth of today to उनसे बात करना जरूरी है, उनको बताना जरूरी है कि आप अपने आप को कैसे चेंज करें. थोड़ी थोड़ी चीजें ही चेंज करनी है, बहुत ज्यादा कुछ नहीं करना है. It's just a little bit that we need to change, and these focusing on the risk behaviors, on the dieting behaviors, on the various attitudes of the youth, they can help us bring down the NCDs. So I think my 5 minutes should be up by now. So I'll hand over the thing to you, and I'm open to any of the questions that any of the panelists or anybody else would like to share. So thank you very much for giving me this opportunity. Thank you.
Thank you so much, ma'am, for showing us the actual figure and the prevalence of increasing NCDs, and how with just small steps and educating our youth, we can stop the prevalence of non-communicable disease. Now I invite Mr. Umar Sharif Mohammed. Mr. Umar is the Managing Director of Roche Diabetic Care India Private Limited at Mumbai, an affiliated company of Roche Group based at Basel, Switzerland, marketing various instrument and product in India. Mr. Omar has over 20 years of strong sales, marketing, project, journal management experience across various product and services. His vision is to bring in true relief to the patient, and very keen on looking into patient need into healthcare. And his motto is, don't tell the world what you can do, just do it. We are so pleased to have you, sir. We welcome you.
Thank you very much. Very good evening to all of you all. Sharp for doing this amazing webinar. I think this is very much required, and you will see snippets of why I say this is important. And Dr. Anshu, thank you very much for kickstarting a very nice discussion. The data is extremely important. The 34% that you spoke about in youth, that is changing the whole paradigm of things. And I will touch upon a bit more as we go through, because my expertise has been 16 years in diabetes care. So Dr. Anshu, just let me take this platform more from a diabetes care perspective, because it's the NCD part which is running quite helter-skelter. And I'll try to, in the next 5 minutes or so, give you a little bit more perspective about where it is heading. And I think I believe with increased focus on the NCD, and we have panelists on the board who have a lot of focus on it, and likewise Sharp is also doing a lot of tremendous work. The government has put in a lot of focus as well, and this is a great time for us to partner closely with different stakeholders to help manage rising prevalence of diabetes in India. And I think this is a great opportunity where we are speaking to so many participants who are from different schools across the country, and with your support, I think we can percolate this message across to different parts of the country. Just to give you a little bit of a sense of what diabetes is as an NCD, it's a pandemic in slow motion. There are roughly close to 78 million people with diabetes in our country. And by the year 2045, we will be roughly close to 134 million people with diabetes, which quite possibly will make India the #1 or the capital of diabetes in the world. Instead, all of us should take this responsibility that we should make India the diabetes care capital of the world. What is even more shocking is we have very limited reimbursement, and 1 in 2 people in our country go completely undiagnosed. And imagine if this is happening to underprivileged kids in towns, cities across the country. This could be very, very dangerous. Astonishingly, by the time I will finish my talk, which is another 4 minutes or so, or 3 minutes, 10 people in our country would have lost their lives due to diabetes. And this is an alarming number. And when we talk about diabetes, I usually follow the rule of halves. So if you look at 78 million people with diabetes in our country, there are only 34 million people who are currently diagnosed, which means 57% of the people in our country go completely undiagnosed. And the same applies to the youth also, and maybe larger number, because in the rural areas, the access to care is very little. So out of this 34 million people who suffer with diagnosis or who suffer with diabetes, only 16 million people actually receive care. This is the access to care. And out of that, only 8 million people achieve treatment targets. And out of 8 million, only 4 million people actually achieve desired outcomes, which is as propagated by IDF or ADA, and hemoglobin HbA1c level less than 7%. So if we did our mathematics a little bit carefully here, out of 78 million people with diabetes in our country, only 5% of the people in our country are in full control. And mind you, this is not only our country, this is across everywhere in the world. So we don't have to feel bad about it, but we still need to take the responsibility, saying, how can we create awareness at the level of youth? And I also wanted to touch base very quickly with the COVID-19 and how it has changed the mindset a bit. The outbreak of COVID-19 has posed several new challenges to diabetes care and has also provided an opportunity for transforming the treatment of people with diabetes. And you all know lockdowns caused by the coronavirus disease have turned the lives of people everywhere. Now, because of the drastic containment and mitigation measures, people with diabetes found themselves without necessary services. This disrupted the practices for preventing diabetes-related complications. However, government bodies and many partners like all of you all in the call, got together, and we created or rallied well during the lockdown to find innovative ways to help people with diabetes. One unique way I wanted to let you all know is that we are currently working with SHARP, and that's one of the reasons why we are also in this call together. As a company, we believe that, and Dr. Anshu, you very rightfully said, it can be prevented. And we have roughly close to 96,000 kids in our country who have type 1 diabetes. And as a result, we realized that this information needs to be percolated, and we reached out to SHARP, and together with them, we have created a diabetes program with which we are going to different schools and making sure the communication is happening. I know 96,000 kids out of a huge country like India is like, a huge task. But I think that's where the opportunity is, to educate our kids to live a healthy life, to also make sure in future they do not get into an area of type 2 diabetes. And I think kids should be aware of this, the youth should be aware of this, and likewise a lot of actions can be taken from us on a day-to-day basis to educate and create the awareness. So with that, I think that's my 5 minutes. So back to you. Thank you very much.
Thank you so much, sir. We've got some, I can see 500 teachers, students, health ambassadors here in the audience, and it's a very good takeaway to tell you how important adolescent care for diabetes and for NCDs can be at this particular time. We have a chance to do something terrific here, and so we're looking forward to do it with your company. Thank you so much. Next we have with us Dr. Shweta Khandelwal. Ma'am is a nutritionist, epidemiologist, head of nutrition research, and additional professor at PHFI, Public Health Foundation of India. She's also authored more than 60 publications, and her work has been published in the New York Times, Guardian, Forbes, Reuters, Hindustan Times, to name a few. She's also the recipient of the Significant Contribution Award by AIMS and the Youth Scientific Award, amongst many others. Can't list your laurels enough, ma'am, so over to you.
Thank you so much for the SHARP team and all my co-panelists. Greetings from me. What better way to start than by reminding all of us this famous quote by Nelson Mandela, where he said that children are our greatest treasure, they are our future. But at the same time, there's also a proverb which says, as you sow, so shall you reap. So it's important, therefore, to bear in mind when we are talking about youth that this trajectory, this this whole transformation of our young children into adolescence happens very, very rapidly. As parents of young children, we know that kaise kitni jaldi bade ho jate hain. So it's important, therefore, for every single day to be an important learning lesson, a sharing thing with children. And today in the audience that we have a lot of school children and teachers, this talk, therefore, is going to be very, very important for most of them, because we are going to discuss some of the solutions and not end at the burden alone. Dr. Anshu very rightly and very nicely, from a programmatic and policy perspective, laid out the burden for us, right? Mr. Omar actually, from a management perspective, told very correct things in terms of numbers, in terms of what they're doing, initiatives. Me, from my prevention and prevention and promotion aspect, would try to highlight on what kind of evidence exists in terms of what works. Okay, what are the gaps, and a little bit of policy hat that I wear in terms of analyst. We'll talk about some way forward for policy as well. Very quickly, the WHO in their 10-year review report specifically called NCDs as the slow motion disaster. The NCDs are responsible for 41 million deaths. I'm not going into numbers, but please know that NCDs disproportionately cause a lot of deaths and mortality and morbidity in LMICs, and India, being one of those, really bears the brunt of it headstrong. In addition to that, these diseases have most of them are modifiable risk factors, and tobacco use, alcohol abuse, unhealthy diets, and physical activity are 4 which have been identified from 1990s. For the last 20 years, as Madam was mentioning, we have been harping about this. There have been several documents and reports now. Evidence has been collected as well. But in terms of conquering NCDs, we cannot pat our backs still. There's a lot to do still. And we know that predisposing risk factors are known to start early in life, and therefore it calls for a life course approach and correction. The World Economic Forum actually pegged it at about $500 billion being lost to LMICs per year. It's not this thing for a decade, it's per year from 2011 to 2025. So this is really huge, guys. All of you, please understand that. And it becomes even exacerbated in COVID times, because we know that COVID is characterized with attenuation of innate immunity and enhancing or aggravating the pro-inflammatory response. And you know that this pro-inflammatory response actually leads to more NCDs. So this COVID-19, therefore, has been projected to cause, one of our papers in Lancet has also showed that about 42 to 66 million people will be pushed into poverty, into extreme malnutrition. And these poor children are even going to be a more significant bearer of NCDs in later life. Zulfikar Bhutta, again, a very well-known researcher, also provided his comments in a very recent paper right now, a couple of weeks back. And he told very clearly that about 14% comes from CVD alone when we talk about pediatric COVID cases as well. So imagine the percolation of NCDs across, the life course. So like I said, my background is diet and physical activity. In terms of diets alone, 11 million deaths in 2017 were found to be causing because of poor dietary habits. And WHO's Director General himself said that this wide occurrence of these, obesity, diabetes, heart diseases are not to be put on an individual, blame that you are eating unhealthy and so you're getting these diseases. Please understand that today as a society, we must lobby for bold political choices, for better programmatic and policy responses as well, because there is a lot of, restraint which is required in terms of the food and soda industries. The access to HFSS, and HFSS is one term we'll all use, which is high fat, sugar, and salt. And this is in terms of nutrition, this is one of the major, bricks on which the NCDs stem up. So it's really important to dismantle this HFSS foods. In addition, the physical inactivity, like I mentioned, 81% of adolescents globally are not meeting physical inactivity. And I'm a part of the expert panel for the CNNS, this Comprehensive National Nutrition Survey, which recently, 2019, was the latest survey which was done amongst children and adolescents. And please know that about 5% of our kids under 5 are pre-diabetic. 10% of our kids are hypertensive. These are really staggering numbers because they themselves show you the burden that the hypertension, COVID, all these things are not for adults alone. It is going down the chain. And when Narendra Modi, our Prime Minister himself, says all the time, enhance their neurodevelopment in his Man Ki Baat, you've seen all the time he's talking about innovation, about stimulating early childhood development. If 70,000 children are born in India every day, and of those, almost 43% of the kids are not reaching their developmental potential. How on earth are we talking about, these issues of fix by just one thing alone? So it's a much graver issue, guys. All of you must understand. There's not a magic bullet that you will ask me tomorrow that what I should do for NCDs and plug it in. In fact, there are a lot of evidence which shows what can be done on a consolidated basis, but we've still not been able to reach them. This is a slide by Dr. Hemlata. Actually, we have just released the NIN, the National Institute of Nutrition, has just released the revised RDAs and EARs. And so those of you who may be interested in youth and children's RDA for food or things, this is available in public domain as well. This was just to tell you that. And again, this is my acronym. For me, youth have the key for NCDs prevention as well as promotion against this. And for me, youth stands for YOUTH. And those of you in Sharp who already know that I love acronyms, this is another one for you. The first one is Y, which is the young ones should be our ambassadors, should be our leaders. You all know about Greta Thunberg. She's making so much noise in climate change. We want some people like those in the NCD space as well, guys. The optimal resources, O is for optimal resources, and it has to be on a sustained basis. Today, the midday meal program goes into a toss because of COVID. Tomorrow, we can again renew. That's not how it's going to be. We have to be better prepared for pandemics. And we know we are messing up with environment so much that these pandemics will come again. And so it's better that you have optimal resources earmarked beforehand. Then the U is for unlearn to relearn. पुराने लोग बोलते थे घी खा लो, खाना बहुत खा लो, बच्चे हैं, निकल जाएगा. Please know that the evidence shows you clearly what you eat has to be, you have to be mindful of eating from day one. आप भाग के और कूद के एक समोसे का calories नहीं निकाल सकते. There is a lot of other dangers like the salt, the sodium, the blood pressure, the sugar, many things which will stay in your body. It will not go off. Even if you're thin, please know that 1/3 of our Indians are thin diabetics. Mr. Omar will confirm that for you as well. So it's not a problem of just weight. It's also a problem of unlearning to relearn from the new evidence. T for me stands for training opportunities, use of technology, and task sharing and task shifting. These T's are very important in today's times when we know that resources are constrained. There is a huge burden. So we must try to come midway and do this. And H, last of all, guys, is harmonious messaging, because this is not one problem or health sector's problem or education sector's problem alone or nutrition sector's problem alone. It has to have, like, my son was doing this unity talk, one finger will break and fist will not break. We have to get that fist out in the NCD space as well. And for me, this is the last slide. Therefore, the opportunity for all our youth to become the demographic dividend for India requires a mind approach. MIND, another one for you, which I'm just making. So M for me, for multi-sectorality, I is for investments, N is for nutrition and health surveillance, and D is for developing local solutions. I cannot come and tell you what to do. There have to be local innovations. And so these early childhood development opportunities must cut across nutrition, physical activity, WASH, access to education, emergencies and disasters, substance abuse and violence, as well as climate resilient innovations. Thank you very much for this opportunity.
Thank you so much, ma'am, for such power-packed presentation. You really opened our eyes and you gave us some new definition for youth and mind. Thank you so much for that also. Anshu ma'am is clapping for you. Thank you so much, ma'am. That was really great and so insightful. Thank you so much. Now, I would like to invite our next panelist, Ms. Neeta Aroda. She is the principal of Sri Venkateshwar International School. Sri Venkateshwar International School was the only school to be awarded the National Healthy School Award in 2019. She has an experience of 39 years in the field of education. She is a state awardee, a resource person, and a master trainer for CBSE. Ms. Neeta was the British Council School Ambassador and winner of National Extempo Speech Brainfeed. She is also the Vice President of Sankalp Sasodia CBSE Cluster. We are honored to have you, ma'am. Over to you.
I am a teacher. Whatever you might have said, I'm a teacher who feels like a mother to each child who she interacts with. So I have that feeling that children must grow with proper life skills. And there I do not believe that this is the parent's job and this is the teacher's job and this is the specialist job. In fact, our jobs are intertwined. Wherever we feel that the child is not getting proper tiffin from home, then we have to counsel the child in a way that the child tells the mother next day, I don't want to get puri aloo. My teacher doesn't like it. She wants me to carry some protein-rich diet. And believe me, you teach that to grade 1 and the life is set. I have been doing it at the cost of sometimes losing some popularity among some parents. Some parents said, Madam, कैसे हमारे बच्चों का टिफिन दे के टोकती हैं? मेरी टीचर से टोक दिया कि 3 chips के पैकेट लाएगा, अर्जुन तू मोटा हो जाएगा. Next day you'll be surprised. I got a call from chairman, Madam so and so teacher has been bullying the children. I said, what do you mean? She's such a lovely teacher. No, she said something which the parents have minded. I don't know what they said, but they know me and they rang me up. I said, sir, in future you will not receive any call from the parents regarding teachers or me. Tell them to approach the principal only. And then I found out, what did the teacher say? The teacher said, ma'am, you came yesterday to our class and you told them I have to check tiffin every day. And to ensure that the children are not getting fried food, children are not getting, only carbs in the diet, they must carry some protein, some form of protein. So she checked the bag and she found huge packets of, now that boy is now the head boy of the school. You'll be quite surprised. And 2, he was obese. And his father didn't like that we checked. Not his father, I came to know his uncle did not like his being checked because uncle would buy him because uncle spoiled the young ones. So uncles would buy him things for bus. And uncle said, teri teacher ki himmat kaise hui tere khane pe tok lagane ki. And so we called the parents did not come. So we guided the child. We said, now you will tell your mother, I want to carry this particular things. And then I started making days. Monday, everybody has to bring some green thing, any green. Tuesday, your diet should have this particular vegetable. Or third day, you can all have some pulse-based. मतलब राजमा छोले में से एक item ला सकते हो आप लोग. So that way and one day we said you can bring in continental, but you will carry salad. So when we made the diet plan for the parents, they understood. And then finally our midday meal plan would go in for a nutritionist, protein, are they 3+ minimum out of 5? If they're not, then the diet has to be changed, preferably 4+. And if you found the fats were 3+, we said too much fat for the children. So consequently, what happened, nursery prep 1-2, when we did this kind of drilling, so the things started improving at homes. And the teachers were not hated for checking tiffins. In fact, my teachers eat with the children in the class. And this is, believe me, the first thing is diet. Second is rest or exercise. Both are required for children. And third is healthy habits and hygienic habits. And if you take care of these 3 things, the children would grow healthy. And then the annual examination is a very, very mandatory thing because there are a lot of things which do not get detected at home because the child seems normal. So whether it's an eye defect or whether it's a hypertension or whether it is even, say, diabetes cannot be tested even in school. But when the doctors ask questions about, do you get up in the middle of the night for urination? She is trying to find out the history of the child. And sometimes these histories can be shared with they're shared with the parents and they can find out, detect a juvenile diabetes. Or if a child is constantly asking for being relieved for toilet, that also is a signal for the teacher to tell to the doctor, this child asks for after every period to go to the toilet. And then the doctor would examine or ask the parents to get a urine sample test done, or maybe a blood test done. And we have detected 2 juvenile diabetes cases because of the way the child behaved in the classroom. We have also detected, I was personally teaching class 10th, I was taking a practical in biology and I was doing blood pressure. I said, I'll take your blood pressure because I just taught circulatory system. So I got sphygmomanometer in the lab and I took blood pressure readings and I told children, you also come and take with me. I found there were 4 toppers of the class, amazing boys, and all of them had high blood pressure. The mast bachas had normal blood pressure. Only these high scoring boys had high blood pressure. So I called the school doctor to my room. I said, Doctor Sir, is there an analogy somewhere that the children who are high scoring, very focused, and they don't waste time, they have high blood pressure? Such as sometimes it may so happen. So we tested other high achievers. And you'll be quite surprised, the high achievers had higher blood pressure than others. 1 or 2 had them mothers in my school as teacher, I asked her, I said, now you take his blood pressure for a week when he gets up in the morning. So that, if the normal getting up blood pressure is fine, that it means the child is now getting some anxiety because he is competing with his friends. And all of them would compete, kaun first aayega, kaun second aayega. Grade 10 in as it is, some children start feeling the pressure. So we told our teachers to remove the pressure. I said, nobody's going to talk to them about kitne percent aayenge or 100 aayenge, 90 aayenge. Just let them enjoy studies. And told the parents also. Otherwise, imagine hypertension at the age of 14. I was shocked. And it was not just minor 120, 150 bhi aa raha tha un bachchon ka. Aur mujhe laga mujhse theek se blood pressure reading nahi hui hai. But that made the eyes open. And now we talk to the children about how to reduce anxiety in the children. Now we come to the topic that you've given us, COVID time. COVID time, again, they could be underweight. And I have seen a lot of neighborhood kids after 3 months when they emerged from the cocoon, some of them had gained weight. Similarly, some ladies maintained their weight, some did not. Some gained, some even, one or two even lost. So she told me, I met my teachers today, she said she was suffering from some illness. But the point is, are we addressing both of these? I know about this kid who was juvenile diabetic in my grade 10 when I was teaching long back in Army Public School. This boy is now in US, but he underwent a kidney transplant now. And he's fine, but he suffered. So this has to be controlled. And as Dr. Shweta, she's a statistician, she's a doctor, she's a nutritionist, she's amazing, the kind of workshop, presentation she gave. And she talked about high salt sugar. So we have a very strict check on the canteen food as well as the food that they get. And this is one important area. Then the eyesight, though it is not really related, it has to be also constantly monitored. And Sharp and other doctors, their health program is very important for all school. Please take it seriously. And I was just thinking after attending this workshop that I haven't done my mid-year medical. I think I'm going to ask my parents to at least, we send them a questionnaire, answer these 30, 40 questions. If you answer wherever, then we'll ask our doctors and teachers to analyze. And we're going to give back the feedback to the parents on the basis of it. And we tell them to be as honest as possible. We're also going to have a questionnaire for the children. All those who are listening to us, and if you belong to a school, please try to do some mid-year medical reviewing or briefing of your children. It is very important because ultimately we feel like parents to them. We feel like teachers to them. So it is our duty not to just ignore this aspect about abhi exam kab honge, course khatam hoga, kya hoga, nahi. I think the health is more important, life skills are more important, attitude is more important. Then पढ़ाई कर लेंगे ये अगर इनको healthy life skills सिखा दी तो ये बच्चे बहुत बढ़िया करेंगे. And why am I mixing two languages? Because there's somebody in the chat asked that please use Hindi. I'm not able to understand most of the things. Thank you very much.
Thank you so much, ma'am. Another applaud from two of our panelists for you. So, and thank you for helping our young generation with such small and fun learning initiatives. Thank you so much, ma'am, for sharing your thoughts with us. And now with such huge participation and active participation with principal, teachers, health ambassadors, I hope our one such webinar can help you all to prevent NCDs among students. And about Sharp NGO always try to put his best foot forward in the field of healthcare, especially for students, by creating awareness and educating them about various health topics and NCDs. Here is a short clip of our work towards non-communicable diseases. And meanwhile, I request the audience to drop their questions in the Q&A box. We will going to take up the question after the video.
for that video, of course. Without further ado, I'd like to begin the Q&A round, something that we've all been waiting for. My first question is to Dr. Anshu. Ma'am, Kaustav Chakraborty from the audience is asking that rate of cancer between 15 to 35 years for the last 1.5 decades has shown a rapid growth in our nation. During this adolescent stage, even parents are not skilled to handle the child, probably because of awareness and skill. What are the basic measures that you propose for children and parents? And is there any immense change of work, habit, and lifestyle required?
So thank you very much for that question. And it's so very relevant, in today's time. As he's very rightly pointed out, that the incidence of cancer has really gone up in this, in the last decade. And basically, in India, we have to focus on 3 major cancers: the breast cancer in women, and the colorectal cancer, and the lung cancer in men, and the oral cancers in the general population as such. So when we talk about these cancers, they're all related somewhere to the behavioral and the other risk factors that are preventable. So again, we come back to the same thing of NCDs, that cancer can be depending on these various factors that we are talking about, and they are all preventable. So again, smoking, tobacco, early on we see children smoking at the age of 14 and 15 because it's supposed to be cool, but then they need to know that this is not cool. What is being cool is to focus more on healthy type of habits. Again, unhealthy diet. Now when we talk about unhealthy diet, there's in the families in the eastern regions, we see pan chewing and betel nut chewing all the time, which is which unaware the child catches on. Unaware the child catches on the habits of alcohol abuse, looking at their elders. So that is where we need to focus upon. These behaviors need to be curbed. These behaviors need to be looked into. And I must say, I must congratulate the principals of today who are focusing so much on the dietary habits. Every time we used to have this discussion that we must educate schools to have healthier food in their canteens. So whenever such an initiative is taken up by people, by the educationists, it should be really lauded, because ultimately these habits are the ones which promote these things. So for cancer as such, again we need to focus upon few things. Cervical cancer can be easily prevented with HPV vaccine if we can immunize all our girls between the age of 9 to 16 with HPV vaccine. We promote awareness of people about HPV vaccine, about screening of women, about because all these endometrial, the cancers of the uterine area, the genital regions, they can be easily detected by early screening procedures. So we must encourage screening of women for these cancers. Similarly, we must encourage healthy habits of brushing their teeth, cleaning up their mouth in the night, especially to see. And that is how even the dental caries as such, it can cause diabetes, it can cause cardiovascular diseases in the later stages, and somewhere lung cancer, colorectal cancer can be prevented with tobacco, with with prevention of these simple habits that we can focus on. Alcohol abuse can itself cause so many things, and it can cause liver cancer, it can lead to cirrhosis, and later on in later stages it can cause cancer. Liver cancer again is again preventable if we can just give hepatitis B vaccine to all the children, during their neonatal stages. And it prevents hepatitis B and C, which can in later stages cause liver cancers. So these are certain strategies that we can take up. Again, the education, the awareness, the counseling part is very, very important. And I think the NGOs, the educationists, and the health personnel, they can all come together on these activities. Simple awareness strategies can go a long way in reducing this. This main thing, this demon of the cancer that we are facing these days.
Right.
So that's what I would like to say. Anything else? I mean, anybody else is welcome to please comment upon. Thank you.
Thank you so much, ma'am. So there's been a lot of conversation from what I gather about schools looking out for signs of NCDs or teachers being the forebearers of change. So my next question is related to that as well. It's for Dr. Shweta Khandelwal. Ma'am, Niva from the audience is asking that can you suggest certain signs of NCDs that a teacher can monitor during online classes?
Right. So like we mentioned, there are 4 risk factors, and one of the obvious signs which we can monitor during class is lack of attention. Because if the child is not rested well, or if he has concentrating problems, there can be micronutrient deficiencies like anemia, like iodine deficiency, things like those, which actually have a graver consequence for later development of NCDs. The second is weight gain, which is very, very obvious and easily visible. So if children are being monitored every 6 months or every once during their class tenure, it's important for them to keep that record in continuation, and also sort of advise somewhere to the parents, as well as along with the BMI charts and things like those, which is very easily doable, and many of our Hriday Shan network schools do that also. In addition, keeping a health and wellness coordinator. So FSSAI recommends that we have a health and wellness coordinator in many schools nowadays, and that wellness coordinator is able to help you not only by solving, as a mental health coach or a counselor, but also discussing if there is any kind of an undue stress, some kind of personal problems, or if you're feeling bullied or things like those. So these are, please do not think that they're not a part of NCDs. They are very much. Mental health is a very, very important part of NCDs also. So I think there are some very visible, Neeta madam had already elaborated what you get in tiffins, behavioral, if the child is too aggressive. So there are lots of ways the teacher can identify. There are 30 or 40 children usually in a class. The teacher, at least the class teacher, usually on a day-to-day basis can easily come to know certain things if she's very vigilant and careful. And all these teachers these days are very, very invested in their children. So I think it'll be useful for them to make extra notes about the child's personality, in addition to just giving marks like madam was saying. So that those things can carry a deeper message for parents. They may mind, 1 or 2% of parents may mind. I don't think we should get hampered by that. But in general, parents will appreciate that response, and they will try to look into this more carefully.
I would just like to compliment that answer by Dr. Shweta. And I think, Ms. Neeta, you also spoke about, and likewise, Dr. Anshu, you spoke about the plaque part in terms of the dental health. The reason why diabetes as a program came into the offering was primarily because of the fact that one of my close family friend called me one evening and he said, my daughter is not keeping up well. She's been losing weight for the last 15-20 days. She feels very tired. She's losing her hair. Today she's feeling a little bit lethargic, and she's getting a bit of fever and stuff like that. And then we asked her to do him to do the entire blood test, not the blood test, the entire body tests and stuff like that. The ketones were very high, lipids were very high, everything was very high. Now, I'm not a doctor, but I've been in the field of diabetes for 16 years. So I knew that it was diabetes ketoacidosis, which is a very, very dangerous stage. You might lose a kid. Now, like Ms. Niti Arora said, you need to identify the signs and do these tests as soon as possible, because the doctors then can suggest what has to be done. So we immediately put this kid into the ICU, and it was detected at the ICU that the kid has type 1 diabetes. So Dr. Shweta, Dr. Anshu, and Ms. Neeta, you're right. We need to find these signs and symptoms. We need to educate our parents also through the mediums of schools or through direct consumer advertisings and stuff like that, so that parents know when to do the tests. And Ms. Neeta, we are very happy that you asked this question. And through SHARP, what we are trying to do is going forward into the next step of screening programs in schools through phlebotomists. So making sure that irrespective of anything, the kids can be identified at some stage whether they have these kind of conditions. So I think that will be our next stage, and we are working very closely now with government of Maharashtra. As we speak, we are in the phase of developing a program, three-pronged strategy. One is awareness, the second one is education, and the third one is screening programs for kids across Maharashtra now. And to the tune, the health minister here has also offered free insulin for type 1 kids. And we have come forward in terms of making sure there are free glucometers also provided in the primary healthcare centers, so that the kids can be screened, if not every day, at least 2 to 3 times in a month. So very right. I think we need to spot the symptoms, spot the areas where the kids feel a little bit different from what they've been doing in the past. Thank you.
Right. So we've talked about self-monitoring, we've talked about the role of teachers, we've talked about identifying signs and symptoms. And Mr. Amar also briefly touched about organizations working towards diabetes prevention. And that was also my next question to you, sir. Rahul from the audience has asked, how can organizations build activities to create awareness in support of NCDs prevention? You've already answered most of it, but would you like to add something to that, sir?
Yeah, so now this is getting a bit commercial, so please excuse me, but I'd still answer this. And we do a lot, and I would quite possibly now go beyond type 1. As a company, we've partnered with emerging Indian business companies like Fable, Wealthy Therapeutics, Farm Easy, to bolster our outreach to people with diabetes. Now, through its partnerships, we've also kind of looked at programs which could help women with gestational diabetes mellitus using monitoring techniques, and therefore healthcare practitioners could then advise them based on ASHA workers, information about their condition in terms of how clinically we could improve the outcome. So this is again a CSR initiative from our side. The second, I could say we could also look at, building partnerships, and COVID has proved enormously huge because people have been very much worried sitting at home how do we connect with the doctors, and this telemedicine facility has improved dramatically, and therefore we're looking at individualized, personalized treatment for people with diabetes. And there, some tech companies like Wealthy Therapeutics have come forward. They've worked with us very strongly to make sure how we can connect the patient with the doctor, thereby them not going face to face during these COVID times, to ensure that the doctor can take decisions based on the data that is being shared between both of them. The other things I also mentioned, we could also go beyond what we are doing on a daily basis of selling our products, but making sure our people with diabetes out there can receive the products in a way that they don't have to wait too long. And that's where we build partnership with Farm Easy, where they could very quickly look at replacement of devices so that they can monitor themselves very well. So at Roche, we are committed to provide people with diabetes a comprehensive diabetes management through innovative, integrated, personalized diabetes mellitus solutions. And in this journey, we have chosen to partner with like-minded Indian startups who are doing path-breaking work to create innovative platforms that enable optimal personalized diabetes management and improve therapy outcomes. I'm confident that together we can bring true relief to people with diabetes so that they can spend more time in the range. One of the examples is the program that we are doing with SHARP. The other one is what we are just embarking onto on the 14th of November, which happens to be World Diabetes Day, with the Health Ministry of Maharashtra. etc. And also to Miss Niti Arora, we are going to go into screening programs very soon. So we might be coming to your schools in association with Sharp and many other partners as well. Thank you.
Right. Thank you, sir. So we've talked a great deal about looking at NCDs in an individual aspect and a more holistic approach. I'm going to take the discussion one more notch, and I'm going to ask Miss Neeta ma'am the next question. And ma'am, Gitanjali Kakkar from the audience has asked, what can be done by a school to help those children who are from families who have a record of tobacco and alcohol abuse and are more likely to suffer from NCDs in the future?
Yes, we do have children who suffer from anxiety because of differences that the parents have, that is psychological. You're asking about addiction. Believe me, when a school which has a strong lifestyle program and a health program, these children would also be able to talk to their parents about de-addiction. I want children to be leaders, not just follow their parents. If the father is a drinker or a heavy smoker, the child need not be. The child can in fact guide his own parent and find out where I can suggest my father to go. Believe me, these days children are very smart. In fact, our own government also has asked us that children will administer pledge to their parents also that when you go out, you'll wear a mask. Everybody is using the school children. I mean, I've seen दुकानदार दुकान बंद करके आते हैं, रात को पटाखे चलाते हैं दिवाली पे. बच्चे रात को 10 बजे तक नहीं चलाते. पापा आए हैं अपना बंद करके शॉप और शुरू हो जाते हैं पटाखे. So that means who is to be guided? It's a parent who is spoiling the children. So, I mean, if the father or mother is somebody suffering from alcohol or drug abuse or tobacco abuse, and the child has somehow shared it with the teacher has to share it with other people in the school, and then a school together can design a program, also make the child aware, in fact all the children aware, and that can happen when you have a multiple set of talks and posters and other events through which children learn these are bad things. In fact, we have a very strong, in fact all schools I'm sure in Delhi has an anti-tobacco program. We used to organize every week in assemblies, dengue control, everything. We're talking about NCD. I'm sorry, I would like to also talk about asthma in school children, arthritis in school children, vitamin D deficiency, which is nutritional. Somebody has talked about undernutrition or imbalanced diet. And these three also have to be tackled, and we can tackle asthma. I mean, now since we have started wearing masks, I remember when as daily pollution rose last year and masks were distributed in school, children wore it for 3 days. And after that, they just stopped wearing it. None of the teachers were wearing it. So we adults did not role model it. Now, if the adults, parents and teachers both wear masks in school, even when COVID is controlled and the vaccine is found. So whenever the pollution level goes up, children would be safer from respiratory disorders. Vitamin D, schools have to take children out for playing. It's so important. We have to make sure that some classes happen in sun. सिर्फ गप्पे मारने जाएं, हम घूमने जाएं, एक राउंड लगा कर आएं, 10 मिनट सिर्फ हाफ शर्ट में, हाफ ट्राउजर्स में, स्कर्ट में, बच्चों को 7 मिनट सिर्फ धूप मिल जाए, उनका विटामिन डी पूरे दिन का मिल जाएगा उनको. We don't have to give them medicines for vitamin D. And you'll be quite surprised when some of my teachers are suffering from vitamin D deficiency. Mine is an AC school. So it's all the more important that they have to go. And then arthritis, I remember there's a student of mine who was arthritic. She could not write a 3-year exam. And she used to always say, "Ma'am, mere ungli thak jati hai." Now she's a doctor herself. But yes, some children may have juvenile arthritis and we have to address it. I also came to know much later that there's something known as psychological diabetes. If you are undergoing huge stress, you may test positive for diabetes, which can be cured. Otherwise, other diabetes may not be cured. They have to be just controlled, and you have to take care of your diet and exercise. So children have to be made aware of the types of diabetes. And if it is a stress-related diabetes, then it can be taken care of. And gestational can also, is not permanent. So children must be aware. Otherwise, अगर diabetes का इतनी बात हो रही हो, किसी बच्चे की positive आ गई तो घबराहट के मारे उसको hypertension भी हो जाएगी. So we have to make sure that the children who have any form of NCD or non-communicable disease are made to feel that you can have the same lifestyle that you're having. Just be more careful. That's all. It's not the end of the road or word for you. And ultimately, why are we talking about health? Why? Not just to have a longer lifespan. I would say a lifespan which is happier, long and happy. Happiness is the quotient here. Let's make our childhood happy, and that all teachers have to do it. Guide the parents, and believe me, when the teachers guide the parents, they also listen. It's not only the children. They may feel initially they're not listening, but they do. उस समय acting करते हैं, घर जाके सोचते हैं.
Right.
All of them think. जैसे आपसे बात करके, I will think about a lot of things. And parents also want the best for the children. They may be adamant, but they're not. अंदर से दिल उनका भी अपने बच्चे के लिए आपसे ज़्यादा धड़कता है.
Shweta ma'am, would you like to add something to that?
No, I was just saying that in addition to all these addictions which people are asking, there's another one which we are missing out is the screen addiction. Please
And-
understand that in today's times, one of the major risk factors for NCDs, like I pointed out, is physical inactivity. And screen time has rocketed like, skyrocketed like anything. So all of us, more than alcohol and tobacco, should also be concerned about screen addiction. And WHO, in fact, has put out that for children less than 1 year, it should be zero minutes of screen time. But I see, even all of us, आप अपने देख लीजिए, अपने societies में, so many parents, toddlers are in their prams. We are still showing them YouTubes and I don't know what nots for making them eat or on different pretexts. To be honest, I'm also a parent, but I'm saying there's some amount of I'm not saying trying to get rid of our duty as a parent, but somewhere we need our relaxation. We think the child will learn like this. But please understand, research evidence, like proper, highly, robustly conducted studies tell you that if the child has seen a screen for ABCD or anything, and versus the parent has communicated verbally, this child who sees the screen does not translate into IQ benefits. Okay, so parents who think हम educational videos दिखा रहे हैं, it's not going to translate into IQ benefits. Only verbal or childhood interactions with parents or caregivers is going to translate into it. And language development, all these things happen faster when there is a human touch. So screen touch से ज़्यादा human touch करें, वो मेरा एक message था. That's all. Thank you.
Thank you so much, ma'am. So with such huge audience, our next set of questions will be taken up live from the audience. So I request Ritik, we have with us Kalpita. So Ritik, can you please unmute her?
Sure, Shivani.
Yeah, thank you so much. Ms.
Hello.
Kalpita, please tell your full name and the city you belong to, and then your question.
Yeah, am I audible?
Yes, you are.
Yeah, my name is Kalpita Shubhankar and I'm from Noida. So my question is, what is the impact of COVID pandemic on availability of resources for NCDs?
Dr. Anshu, would you like to answer this question?
Yes, thank you very much. So, with this is a very relevant question today, and I would like to say that this with the COVID pandemic, everything has been affected. It's not only the healthcare resources; it's all kind of resources. You have seen the economy going down, and you have seen all kinds of resources have become difficult. Now, especially for NCDs, when the awareness, the all these things that we are already talking about, when all of these things are to be given to such a huge number, then especially with COVID times, when we have to restrict ourselves to our homes and to our local areas, then it becomes all the more difficult. Plus the anxiety, the fear, the fear of catching the pandemic if you go out into the open, that itself. So all these things have actually created the problem. The fear of going out into the open and catching the pandemic has made people stick to their homes. That has created the anxiety. That has also given rise to limited activity, the lack of physical activity, all these things. Plus, you are not able to go out and buy your medicine. So most of the time, you have to depend on your youngsters. Half the time, the elders don't come out with their requirements. They don't tell the youngsters who are only working online or who are already faced with loss of jobs. So they don't want to tell their requirements. So naturally, they don't get their essential requirements. The government is trying their best, at this particular time. The CGHs, the ESI, they have made special provisions for delivering these medicines, the essential medicines, to the to the homes of the beneficiaries. However, that itself is not sufficient. For the whole general population, resources like getting their tests done, getting the essential medicines, getting the essential, the nutrients, everything has become a big dilemma. So all this needs to be tackled. We need to focus upon how to encourage people for online shopping, for going digital, for asking for teleconsultations, for making them, independent in their own way, making elders understand that they are independent, they can go ahead and become digital, and youngsters can really help the elders in all these things. So though there is a limited resource setting right now with the corona pandemic, but you have to learn to be innovative, you have to learn to come out of it. And I'm sure there are various ways and means with which people will come out, and we'll have newer technologies, newer methods to tackle these issues. So that's what I want to say about resource setting. Yeah, thank you. Anything anybody is most welcome to add, please. Mr. Omar, Dr. Shweta, please come out with your whatever strategies that you would like to suggest. Thank you.
I think you already built the platform, so I'll just add more from a diabetes care perspective and from a more commercial point of view. What are the trends that we see today in the marketplace? So yes, let's talk about diabetes then first. So some of the issues and challenges that have emerged include the reported high incidence of COVID-19 infections among persons with diabetes, resulting in a higher number of ICU admissions and higher mortality reported in them. And Dr. Anshu might know much better than me. Almost roughly close to 73% of the people were having comorbidities when it came to the mortality. And the increased predisposition of patients with diabetes to COVID-19 infection is believed to be related to a compromised innate immunity that accompanies uncontrolled diabetes. Now, in current times, people with diabetes have to be even more vigilant about their health. They should practice something called as glucovigilance, and you will see that in NDTV very soon. So we're running this program from today, which is to keep a regular watch on their sugar levels, eat a balanced diet, exercise regularly. I know it's very difficult, but you can still do it at home with yoga and stuff like that. And I'm a person who bikes quite a bit, but I've not been biking for almost 7 months, but I've taken up yoga, and that's even more intensive, I have to say. So exercise regularly, take medicines properly, and monitor yourselves. A high degree of alertness with frequent self-monitoring of blood glucose is certainly advisable in known patients with diabetes, particularly insulin users, to reduce the risk of being affected with COVID infection and avoid any undesirable consequence. And also, I just wanted to touch upon what Dr. Anshu just said. We saw 3 very important market dynamics that happened during COVID. And this was amazing because we thought this would take 10 years for us to get telemedicine into the country. But 50 million users over March to May have happened. A fast adoption. 80% of the users are the first timers. And we always keep saying that, this telemedicine or digital things only happen in metro cities, but this is the first time we have seen 44% from non-metro. So that was the first trend. The second trend was e-pharmacies. Rapid growth, 157%. So more and more are using it. Then we saw, engagement of healthcare professionals. And this is a classic example. We have 500 people interacting over a webinar, which would have never happened otherwise. And then, as Dr. Anshu said, direct to consumers. That means we also, as a company, we're trying to see how we can create web shop solutions where people with diabetes can come in there and buy stuff which they require for their daily monitoring purposes. So this is what I wanted to add. Thank you.
Thank you so much, sir. Thank you so much, ma'am. Ms. Kalpita, I hope your question was answered.
Thank you.
Thank you so much. So next we have with us Ms. Shrishti from the audience. Pritik, can you unmute her?
Yes.
Hello, Ms. Shrishti. Please. Hi, Ms. Shrishti. Please tell your city and your question.
Hi, good evening, everyone. Am I audible?
Yes, you are. Yes,
Yeah.
you are.
Yeah, my name is Shrishti and I'm from Saharanpur in Uttar Pradesh. So my question is, how can counselors in school help to reduce hypertension among youth during the pandemic? Thank you.
Thank you so much, Ms. Neeta. Ma'am, would you like to answer this question?
Rishi, what a wonderful question. All of us feel the need to make aware of how I would say fortunate they are. We have to make them count the blessings. And for that to happen, the teacher also has to count her own blessings. You're talking about counselor. Counselor comes later. Everyday teacher, each class is a counselor in a way. The counselor's job is to act on when the teachers have reported. If we tell the children that you're very lucky to have all your organs working, you're very lucky to have a roof over your head, you're very lucky to be able to come to school. There are so many children in our country do not have, let them feel happier about that. Anxiety is due to, I don't have this, I don't have this kind of look, will I have a bright future? Or my family doesn't have a big car and this child's family has so much, or he brings so much from canteen food, I don't bring. So you have to find out the reason why is a child feeling anxious. Sometimes not in front of the class, sometimes away from the class. And that can only happen when you have a policy of, giving anonymous feedbacks. You give the feedback, what causes anxiety to you? When do you feel happy? When do you feel unhappy? What makes you happy? Simple 5 questions, and you can sort out your children. You can guess what causes anxiety in this child. So you should have such forms as a teacher, which you can design, or the school has it, the lovely. Otherwise, every month you should have such. Who are your best friends? And who are the children whom you find as bullying? Who are the children who use abusive words? Which children do you see as role models? So you know whether the cause of anxiety is coming from friends, or is coming from home, or is it coming from the child's self-concept, which is low? So all 3 things a good teacher would be able to analyze and share with the counselor. And then the counselor will have, how many counselors can a school keep? 3, 4, 5. So that means everybody, each teacher, every principal, every headmistress is a counselor. And if we recognize that role, that we are a counselor too, believe me, the counselor would only be dealing with severe cases which have been diagnosed as SLDs, learning disorders, or autism. Small cases, anxiety related, which leads to hypertension in children. Low self-concept, that should be addressed by all subjects teachers together. The staff room gossip should be about how can we help this child? He's or she facing this issue. I have seen children facing issues scored low in a particular class test or a unit test. And the father's already warned him, तेरे 4 में कमाए 5 में भी कमाए तो देख लेना. बस वो ट्रिगर बन जाता है बच्चे के लिए कई बार suicidal tendencies का भी. So you have to be very careful about telling the children marks are not everything. Then you give examples where every children have become big in life. It's not necessary that I always gave, my toppers did not clear the medical entrance, but my average, so-called just above average, cleared it. The topper was only focusing on learning each and every word, did not go into details. So the CBSE topper may or may not crack the competitive exam. So you give examples of both kinds. Sure, your topper should feel low. Mera to clear hi nahi hoga, madam ne bol diya pehle se. So you have to give positive examples of both kinds so that everybody sees there is something. And then always tell your students to have more than one dream. This I have seen worked like wonders. जो बच्चे एक ही ड्रीम पे फोकस हो जाते हैं क्योंकि माँ बाप ने कहा तुझे तो बनना यही है, और टीचर को भी सिखा के जाते हैं बस इसी से इसको भटकने मत देना, खेलने मत देना, डांस मत करने देना, म्यूजिक मत करने देना, क्योंकि इसको बड़ा होके ये बनना है. 9th में आते ही बच्चों के ना सडनली बहुत सारे कर्टेल्स हो जाते हैं. Madam, don't send him for this, don't send him for this event. I have guided my parents. My children can participate in anything and still they do very well. 11th, 12th, yes, we do allow them to choose whether they want to go or not. But again, having more than one dream will make them happier क्योंकि लाइफ में कोई जरूरी नहीं होता पहला ही ड्रीम आपका सक्सेसफुल हो जाए, पहला ही लव अफेयर सक्सेसफुल हो जाए, वो भी नहीं होता. So children have to be told that you can have many choices in life. Don't fall for the first guy or girl who proposes to you. And don't think this is the end of, but yahi hai bas final. So just do not get too close to anybody. You also have to tell your children to not be promiscuous. You have to give that example. You also have to guide them what to write on the social media. That's very important क्योंकि बहुत anxiety का cause बनता है बच्चों को. मैंने पता नहीं सारी लाइफ हिस्ट्री बता दी थी अपने पिछले बॉयफ्रेंड को और वो सबको बताएगा. मत शेयर करो भैया. नेट पे किसी को गाली मत दो, नेट पे किसी को बुरा नहीं बोलो, पॉलिटिकल स्टेटमेंट्स भी मत करो. यू डू नॉट नो व्हाट कैन यू गेट इन ट्रबल व्हेन योर ओन माइंड वुड चेंज. डोंट अब्यूज योर टीचर ऑन नेट क्योंकि कोई और बच्चा उसका स्क्रीनशॉट लेकर बता देगा मैडम को फिर क्लास में तुम्हें एंजाइटी होगी, तुम्हारे माँ बाप के सामने पेशी हो जाएगी. सो ऑल दी स्मॉल थिंग्स, एंड देन यू हैव टू गाइड द पेरेंट्स. अपने बच्चे को अपनी एज ग्रुप में ही खेलने दीजिए. प्लीज डोंट सेंड योर चाइल्ड विद सीनियर्स ऑन देयर सीनियर्स बर्थडे पार्टी, बिकॉज देयर बिहेवियर इज डिफरेंट. And a 9th class child mixing with the 11th and 12th is bound to have some problems. Either or she to have an elder sibling. So the parents have to be guided, children have to be guided. Sometimes you have to be strict, sometimes you have to explain. So counseling, think like a parent, think like a teacher, you will be able to manage.
Thank you so much, ma'am, for this small steps you told us. It was really great, and I hope Shrishti got her answer too. So next from the audience, we have with us Kritika Garg. Ritik, can you unmute her?
Yes.
Hi, Kritika. So Kritika, where are you from? And you can, hi, where are you from? And then you can ask your question.
Hello, I'm from Sangrur, that's in Punjab, and my question is specifically for Dr. Shweta ma'am. And so, ma'am, I'm a student and I'm on the screen for more than 10 hours a day. So, how can I bring down my screen time and care more for my eating habits and physical activities?
Very good question and relevant. So congratulations for asking that bravely and admitting that you are more than 10 hours on the screen. I understand that. And in fact, if you will understand, we as people who are working professionals also actually have to end up being on screen many times. But your brains are developing at a different rate and phase than ours. So it's important, number one, to keep 2 or 3 things in mind. Number one, at least have healthy breaks in life. Secondly, like healthy breaks as in, I will give you a 9-to-1 formula, perhaps that will be useful. I'll just take 2 minutes, but I'll give you that. That's a useful formula. First is 9. 9 means 9,000 steps. Make sure you invest, these are not very expensive these days, in wireless something in the earphones which are not connected to the screen, whether it's a phone or a laptop, so that you can move while also listening or hearing your podcast or your class lecture or your things. So number one is that at least try to bring in movement there. 9,000 steps. 8 means 8 hours of sleep. So when you are already on 10 hours of this thing, make sure that those 10 hours are not on a continuous basis. You have your 8 hours of peaceful sleep. 7 glasses of water. It's important that you at least have hydration breaks. So by that, by default, your mind will be going to that glass of water. You will switch your eyes. You will, blink your eyes. You will have at least water. So 9, 8, 7. Right? Then 6 is for 6 minutes of meditation. So anywhere during your 10 hours, do not have them at a go, like I'm saying. Just have 6. And meditation doesn't mean that you have to do Om and Shanti only. Meditation just means taking your mind off and just remembering something which gives pleasant. So it can be music. It can be something which you like, maybe looking at, something in your mind, thinking about something which you're enjoying. So those 6 minutes of meditation, giving peace to your mind, just calming your mind is also very important. Then 5 fruits and vegetables a day. It's important then you tell your parents to at least have some form of fruits, raw fruits and vegetables during your meals, or have those as a ready to eat snack on your table rather than having chips or biscuits. Please understand, 80% of our parents think biscuits are healthy. Whether you take digestives, please, they are not healthy. Number one, I know this is not a biscuit forum thing, but I'm just telling you, do not reach out for these kind of processed industry snacks. Go in for fresh fruits and vegetables. Okay, so 5 for that. So 9, 8, 7, 6, 5. 4 is for 4 minutes of break. So 4 meals of the day and break. Sorry. So when you are doing something, just take a rest break. 4 times of rest break. So when you are doing something, just do it for 20 minutes, take a rest break, then another 20 minutes or 1 hour and take a rest break. So just go and take a stroll. That doesn't mean that you have to get deviated. Maybe you keep remembering the points which you were doing, but just take a break for those. And then 3 is for 3 main meals and 3 small meals. So when 3 main meals and 3 small meals, you will take a break. So those 10 hours will break somewhere in the middle. Then 2 is for 2 hours before going to bed without your screen. So at least your 10 hours should be during the time when your mind is awake or when you're attentive. Do not do those 10 hours or any of those 2 hours near bedtime. Bedtime se pehle aap please phones ya screens chhod do, because that helps to relax the mind, calm the mind, and also give you good quality sleep. So that's important. And one is for one physical activity a day, darling. So whether you do your calls on, just take these headphones and earphones and walk and do it, or you actually do a yoga exercise like Omar was telling, or do a biking thing by being with your friends in the society. At least wear a mask though, but you can do those things. So this is my 9 to 1. I always tell all people that, I somewhere teaching is also what I like to do, and I am an additional professor as well. So I try to break down things into smaller acronyms so that people remember it for a longer time. So hopes to see that 9 to 1 will help you get your 10 hours broken into something, and I'm able to answer for you. I hope that's okay.
Thank you so much, ma'am. I think this was the most fun learning reverse counting I have heard and I have learned. Thank you so much for sharing. And Miss Neeta, ma'am, would you like?
Yeah.
You were saying something.
The highest thing is love yourself.
Right.
Never take it. Please love yourself with your strengths and weaknesses. The way you are wonderful. Just try to enjoy yourself as you are. Don't compare yourself.
Yes, thank you so much, ma'am. And thank you to all the panelists. We cannot take all the questions due to restriction of time, but thank you for such a great discussion. We learned about so many things. A new reversed counting, Shweta ma'am told us, and how we can love ourselves and how we can prevent NCDs with just small initiatives, and how youth themselves can prevent non-communicable diseases. Thank you so much to all the panelists once again. Mahima, would you like to add something?
Just that it was a very, very hearty discussion, and we've had like a number of panels on nutrition, but this was a very fresh perspective, I believe, because we had educationists, we had nutritionists, we had perspective from agencies and CSR as well. So thank you so much, everybody. Mr. Omar, Neeta ma'am, Shweta ma'am, Anju ma'am, thank you so much for being here on a Saturday and for giving us your valuable time and discussion. There's some little bit of information that I want to give everybody in the audience. Ritik, can we have the screen, please? All right. Yeah. All right. So thank you so much for attending today's webinar. You can subscribe to our webinars on www.schoolindia.com/subscribe. Other than that, we also have a post-assessment form that's going to come up on your screens right about now. It's just a little feedback form with just 2-3 questions. I request everybody in the audience and the panelists to please fill it up. Other than that, since there's been a lot of conversation about awareness in schools, we're organizing 2 free digital awareness sessions, that is on Conserve My Planet, which is for the environment, Greta Thunberg, #Greta Thunberg. And the second one is for eye care during COVID-19. We're trying to target 5,000 schools pan-India, since there's been also a lot of discussion on screen time, just like Kritika asked. So thank you so much. You can register for it on www.schoolindia.com/subs-I. That was it from our side. Thank you so much, everybody. Your certificates will reach in the mail. And happy Diwali from the Sharp NGO family. I hope you're safe. I hope you're happy, and happy festivals to everybody. Thank you so much.
Yes, happy Diwali to all of
Happy
you.
Diwali. Bye-bye.
We actually were awaiting Conserve My Planet. My teacher just told me, ma'am, earlier we should do so many activities. I said, COVID time, they've given us less because they're not going to have 3 months face-to-face. But you got to take it as well as we did in previous years. Thank you. And we just registered Conserve My Planet. We want your IK program, awaiting that. Thank you, Omar. Thank you, Mari.
Thank you.
You were amazing. And thank you, Dr. Anshu, our biochemist, talking about it.
Thank you so much, ma'am. Thank you so much.
Panel I participated in. Believe me, I loved it. Thank you, Shivani.
Thank you so much.
Thank you.
Thank you.
And participants, you all were amazing.